Okay, very good evening everyone from SNCC Rehab Foundation. I'm Harshali Kharche, founder and a director of SNCC Rehab Foundation. Here, we are here for a very interesting topic, that is sensory overload in autism. SNCC, I'll just introduce SNCC. We are based in Nagpur. SNCC is Special Needs Integration Center. Our basic motto is to create awareness about various disabilities, sensitize the society about the inclusion, acceptance, and various interventions, to establish the support system for the parents in various areas like advocacy, emotional, mental health, and child's development and habitat, even for the finance sector, to sensitize the government, personal, and eminent personality of the society about the challenges faced by special needs. The basic, our motto here is to, providing a conducive environment for children with special needs, so as to facilitate their development and help them to develop their potential to the fullest, and enhance their independence and enable them to become well adaptive in the society. For that, we are coming up with various projects like recreational center, community support center, social rehabilitation center, integration, and vocational daycare residential. Sorry for the disturbance, everyone. My kid is bit hyper. Uh, Here, our motto is to educate the parent and develop their perspective towards the right kind of interventions and treatments. Today, we have Dr. Sumit Shinde, a well-known pediatric occupational therapist and rehabilitation consultant from Child Rehabilitation Center, Mumbai. He will guide us on sensory overload in autism. Thank you, sir. Thank you for this. Welcome, and over to you.
Can you see the share? Hello? Am I audible? Hello?
Yes.
Right. Right. So today we are going to discuss a wonderful topic. A wonderful topic. Why wonderful? Because this is एक हिंदी में कहते हैं जड़ या in Marathi we speak मुळावरती घाव घाणे. So it's like it's a root cause of why the autism is not treatable, or why the autism is becomes difficult in overall developmental disability, or most of the developmental disability, why they are not why the child is not able to get into a most normal condition. So sensory overload is the reason behind it, because when we say a developmental disability, so what exactly is a developmental disability? I just want to ask a few questions to the audience. What exactly happens in a developmental disability? Why the child is called developmentally disabled, or child is having some developmental issue? What exactly is the matter with the child? Can you please tell me? Let's have some interactions. Let me understand what audience wants to understand, what exactly the audience viewpoint is. So what exactly is a developmental disability? Please tell me. You can type it in the chat box. So developmental milestones missed or delayed. Yes. Child doesn't develop as per the age. Yes. The milestones are not achieved regarding with the age. Yes. Right. Certain milestones are delayed. Okay. Right. Yes. So is exactly what you said. It's a developmental delay or milestones are not happening. It's a brain dysfunction. Okay, but if I take 50 people's MRI over here or PET scan over here, I'll tell you one thing, that nobody's PET scan will match with the ideal PET scan, or nobody's MRI or CT scan will match with the ideal CT scan or the ideal MRI scan. Yes or no? There must be some doctors sitting here. They may approve these things. So it has nothing to do with exactly, yes, and uh, unless and until we don't come up with some symptoms, unless and until we don't come up with some issues in the development of these things, and then we go and correlate that MRI scan or some CT scans with the development, or not with the development, with the dysfunction. So it's not about a brain's dysfunction. It's about everybody has a dysfunction in this world. Nobody's complete in this world. So everybody has some other dysfunctions. But when this lack of functions affects the person to develop, or affects the child to develop his normal developmental milestones, or we can say average developmental milestones. It's not necessary, it is a normal development. I take my word back, it's not a normal developmental milestones. It's an average, how an average person develops in a society, or child develops in a society. So average developmental milestones. So it causes the delayed in developing some kind of a milestones, and delayed development, we can say, and that's called as a developmental disability. That's a major challenge in the developmental disabilities. Coming to the autism, because this lecture is sensory overload in a particular disorder called autism. So coming to the autism, what exactly is autism is? Can you please put it into the chat box? What is exactly autism is? Because I'm stressing more on autism nowadays. So my question to you all, what is autism? Great. Autism is autism spectrum disorder. Nice. What is it? What is autism spectrum disorder? Yes, please tell the symptoms. What exactly? Write down instead of symptoms. Okay. Tell me the symptoms. Gap in a socializing. My child body and mind are not working in parallel. Okay. Cognitive disability. Okay. It's a neurological dysfunction condition. Social communication, dysfunction of sensory issues, not able to connect with the people. Sensory dysfunction. Okay. Right. Echolalia. Okay. Repeated actions. Okay. Right. So the autism is let me tell you the definition, because I always stress on the definition, because whenever we see a particular thing, we try to understand the molecule of it. And autism is a neurological developmental disorder. Oh, something is up. Brain has 4 lobes and not proper function and connections of neurons. Okay, fine. That's difficult. Social, emotional, speech, language difficulties. Okay. So this is autism is a neurological developmental disorder where there is some issues in the development of the neurology, development of the functioning of the brain, in which the child shows 3 things. One is a lack of social interaction. Okay. Then because of lack of social interaction, there is no development of communication. Okay. And third thing is, just because the child is not able to understand the environment properly, child is not able to, the brain is not able to process the environmental stimulus coming from various sensory systems properly, brain develops a kind of a coping mechanisms. Okay. And these coping mechanisms gives a kind of a soothing or regulation to the brain. Okay. Or help the brain to calm down. Okay. And these are the repetitive behaviors which are called as stereotypical behaviors. Okay. So apart from that, we can say uh, the negative behaviors, or tantrums and meltdowns and sensory issues and a number of things is not a part of autism. Okay. but और sensory issue, I mean sensory integration dysfunction, we can say sensory issues नाम का कोई चीज नहीं होता है. So so when we call it autism, but then if the child is having a sense communication dysfunction, social interaction dysfunction, and stereotypical behavior, then there is a lot of documentation is done on sensory overload. So when we studied in our occupational therapy, when we studied with the various scientific researches, various approaches, okay, in thoroughly, so we came to know that the information comes to the brain. A brain's overall functioning is dependent upon how it receives the information from the brain and how it receives the information from its own body, how it processes it, how it creates a kind of a appropriate picture to that information, okay, how it adapts to that information, how it creates a kind of a coordination with that environment, that is called as sensory processing, and that sensory processing helps the brain to regulate or to understand the environment, and by understanding the environment the learning happens, and that's how the higher functions of the brain develops. We can say I always say in my lectures is like memory, speech, language, communication, orientation, thinking, imagination, emotion, decision making, problem solving, analytical thinking, creative thinking, reasoning. So how they develop because how the brain keeps receiving the information and keeps processing it. After processing it, send a control to the body parts moves, and that's how an experience happens, and that whole experience goes back to the is stored in the brain, so that if the next time same information comes, brain this time while processing this information refers to the backside or those experiences which brain got in the previous manner, and this time the brain sends a better control to the body than before, and that's called as a learning. So this learning gets affected if the sensory systems or whatever this information, if the sensory systems are intact, ears are intact, eyes are intact, skin is intact, okay, then my body is intact, my taste and smell, my cranial nerves are functioning properly if I see from outside, but still they are not able to create a proper adaptive response. They are not able to, whatever the information has gone through them, they're not able to properly understood by the brain. Then it is called as sensory processing dysfunction. So when we say sensory processing dysfunction, it can process in a haywire way. Sometimes it can process properly. Sometimes it can process with a underlying or with a low functionality, or it can process as a very high responses. Sometimes it will process normally. Sometimes it can process with a low functionality, and sometimes it can process with a high intensity. So that's called as sensory processing dysfunctions. I'm not going to go in detail about sensory integration therapy, but this is very important for everybody to understand. There is no sensory issues. There is a sensory processing. There is a sensory under sensitivity, or sometimes I'm somebody's touching me and I feel I'm not at all getting awareness. So it's a hypersensibility. And third is somebody touches me and I feel that person is hitting me. That's a hypersensitivity. So we are talking about a sensory hypersensitivity, or in a very layman term, it is called as a sensory overload. And that is more seen in autism spectrum disorders, because autism is a information processing disorder. It is not a brain dysfunction. It is a brain is not able to understand the environment, due to lack of neural development, we can say. Okay, so if I ask an autism child, what are you? He will say, I'm normal. I'm absolutely normal. But all these people are abnormal. I don't know why they are going out, why they are wearing clothes, why they are wearing different clothes. He says, I'm absolutely fine. I don't have any other issue. But the world wants to change me as per their way. So autism child will never come to say, is there any child who's come to you that I'm feeling this problem and I want to change myself? Some person has a depression, some person has a some person has some mental health issues, they may come to us and they may say that they are having some difficulty in uh, in in their behaviors or in their personalities, and they come and seek the guidance from the psychologist. But I haven't seen an autism child or autism person, adult autism also, came to me and he said that I am not able to communicate, I am not able to interact socially. Okay, and I don't know why I'm able to do the repetitive behaviors. So if I ask, or if we ask a child with autism, suffering from autism, that are you abnormal, he will say no, I'm absolutely fine, I'm very much normal. So I personally will not call it as a, the child is known it's a dysfunction. So child understand himself as I'm definitely functional, but I'm not able to understand what the environment is expecting from me, or I'm not able to understand what is happening in the environment, and that's called the sensory overload. uh, थोड़ा सा ज़्यादा intellectually लिया मैंने ये. Okay, so let's come to the topic in a very layman way. Sensory overload in autism. What is sensory overload? Sensory overload is a overstimulation of one or more bodily or body senses. We can say the which is touch, sight, the taste, smell, or hearing, and the most important is a vestibular sense. So this is, if these senses are not able to process the information coming from the environment and the body, or they process something extra, you know, or they get overstimulated, you know, or the brain feels that whatever information is coming is more than normal, more than usual, then it is called as a sensory overload. Let's take an example of sensory overload. Like now let me tell you, every person may have in this world about different thresholds of how the sensory information is processed in the brain. Few people like to hear the loud noises. Few people like to hear loud voices of the TV and all. But at the same time, there is some person in the family, maybe mummy, maybe papa, maybe mausi who's staying with us, maybe chachi who's staying with us. They may say कि why the TV is so much loud, please reduce the volume. और वो जब आता है वो एक ऐसे they come to us in such a negative way. They tell us that we lose the interest of watching that movie or watching that cricket match or watching that program or something like that. Nowadays it's not very much regular, because everybody has their own screen and they are watching it from their earbuds. But 10 years back, this was a regular situation that somebody used to come and say, why this TV is loud, TV is so much loud, or why you want to hear it, itna आवाज आ रहा है ना, मुझे kitchen में आवाज आ रहा है इतना बड़ा आवाज, why you are this thing. So that's something like people process the information at a different threshold level, you know. So if I want to share a new share and I want to go to a whiteboard. So every person, if I say this is the normal threshold every person has. Okay, so if I am saying A, B, C, D, E, F, G, so few people heard it at a proper threshold level. Okay, few people's threshold may be higher than that. So whatever I said, that may be a lower than that, and few people may have a low threshold. For them, this particular information, whatever is coming to me from me, A, B, C, D, E, F, G, is higher for them. So few people may say that, yes, Dr. Sumit, your sound is coming properly. Few people may say that we are not able to hear you properly. Can you please be a bit louder? And few people may say that you're too much loud. Can you please lower the voice? Then I'll tell them, please lower your computer voice. So it's something like, it's everybody has a different threshold. If this way, sorry, either this way, or this way, you know. So every person, the way they receive the touch. Few people love the linen clothes, like cotton clothes. उसमें वो जो खादी के garments होते हैं, तो उनको बहुत पसंद होते हैं. But some people, when they look at the khadi garments, you know, their skin start itching. Few people are very good in wearing ethnic clothes like those khadi and all those cotton related clothes, but few people, they want silk or they want a very soothing things to this. Few people get very much get affected by with the tags and all. So this is called the tactile threshold. For sometimes some people the tactile threshold is very high. Okay, so they may wear very different textured clothes also. Okay, the people who are having a high tactile threshold, let us assume that high tactile threshold, I'm just giving an example. Okay, they may like more and more touch. They may want more and more, they want to wear more ornaments, they want to groom a lot to self. So they will always ask for some kind of a touch, you know. So that is called a high need of the these things. Some people are like, sorry, I just said ulta. Some people are like low threshold, so for them, and some people are high threshold. So for them, if the information comes, so they may say it is low. So sometimes few people wants to wear the ornaments, few people wants to do the tattooing, few people have done whole body is tattooed. You know, it is something like their tactile input needs a high threshold, so they want that touch again and again. So they want to be hugged, they want the tighter clothes, or they want to you know, to get more and more inputs from the touch. But few people who are having a low threshold, you know, and sudden some kind of a touch, somebody comes and touch them, so they say, who, what happened, why you are touching me? Always tell me that you are coming. So few people may not like anyone to touch their face or anyone to touch their this thing. So that is called the low threshold tactile input. Same thing may happen that the visually, same thing may happen auditory point of view. Same thing will happen with the vestibular or bodily inputs like movement. Few people are having a low threshold with respect to bodily movements or body uh, inputs. Body, no, I will not say body awareness. You know, it's like a vestibular sense. You know, so vestibular sense is like they want a movement. So the slight movement, उनको अगर थोड़ा सा भी turbulence आ गया flight में, so they are like gone, I'm gone. और थोड़ा सा swing थोड़ा सा ज़्यादा हो गया, और these people doesn't want to sit on a swing also. So they are very okay with slight movements in the life. But few people may sit in the giant wheel and they are like enjoying that giant wheel, and they want that much of movement, and then that movement will give them a lot of gratification and learning, and they will feel great about themselves. But if the same in the same giant wheel, okay, अगर ये छोटे low threshold वाले को अगर बिठा दिया हम लोगों ने, तो this person may get a panic attack. This person may get a heart attack also in that giant wheel. So this is something like everybody is a different person. Every person has a different behaviors, different likes, different. They want to be in a different professions, different dislikes, different strengths, different weaknesses. It is mainly because every person's all seven senses, or let's say all six senses. The seventh sense is more of proprioception, but वो लगाम की तरह काम करता है सब लोगों के लिए. So that I'll tell you at the end. Okay, so all the six senses have a different kind of a thresholds. So few people may like a spicy food, but few people, the spicy food are amazing. They will ring the bell in the restaurant and they say, amazing cook you are, you know. And then few people in the same restaurant will say, what, kya, kitna spicy khana bana hai? You know, this is you know, worst restaurant I ever gone to. So everybody's taste is different. Everybody's taste is not different. Everybody's the way they receive the signal coming from the food. Okay, that threshold is either high or low or maybe normal. You know. So when we talk about autism, just a moment, let me share the screen. Okay. So when we talk about autism, these thresholds are not like this many sensory systems has a variable thresholds. Okay, for example, the child visual sense may be having a low threshold, so he wants to go out and he wants to explore the environment. He wants bright light, he wants to see everything what is there inside. So his vision wants to get more and more information, you know. So But the same person, but the same child will have a tactile high threshold that if somebody touches him, he will not like, leave me alone. I want to let me see the environment alone. So every person, another autism child, okay, having the same behavior like humming, or he's not writing, or let us say he's not sitting in the classroom, or he's a bit hyperactive, may have a low visual threshold or a high visual threshold. He doesn't want to go out. He doesn't want to see the things, many things. He's okay with the sitting in a house, okay, but have a low tactile threshold. So he may want to hug everyone. He may want to cling everyone. He always wants somebody's touch, or he will keep scratching his body, or he will keep showing the necessity towards the touch and all. But both the kids are hyperactive. It may happen. So it's very important to understand that no two autism kids are same, because the sensory thresholds are very much different, and that will be understood by a very well experienced sensory integration therapist who is having a knowledge of human development, human behaviors, and the human natures, definitely human ways of reacting to the environment. So this is called as a sensory thresholds, I said. So what is sensory overload? When the person is operating from a low threshold, or let us say from a low threshold, and information goes very high, so what will happen? For him that information will be very high, or maybe normal for the another person, but for this particular person or a child, that information is very high, and that child or person may show aversive responses to that particular thing. I would like to show you a video now. Okay. Just stop sharing. Okay. Let's see a video. Can anyone show me, or did I delete it? Okay. I'm just sharing. Sushant, can you please tell me that you can see? Can you see this video? Can you see this video?
Yeah, yes, we can see.
Can you hear the video now? Can you hear it?
No.
Can you? Okay, I don't know the.
There is a setting.
Okay.
Click on more.
Where more?
Bottom right side. And there is option to enable computer audio, computer speaker sound.
Where exactly? In which this thing? Basic, advanced files.
There is option more.
Where exactly? But where to find more?
Bottom right side. Or share screen optional, so you can, I think, check.
Share sound.
Yes.
Okay.
Share computer sound.
Okay. Just a moment. Can you hear the sound?
Yes, yes.
Is it visible?
Yes.
Six, 7, 8, 9. Take my hand. It's fine, isn't it? I'm not naughty.
Would you see this video?
Yes.
Yeah, so I just want to ask everyone, this video is there in available on video or on YouTube. So what happened? So what happens in video? Can anyone tell me? Yes. Okay, it was auditory overload. There's some issue with my technique. Stop sharing. I'm just stop sharing. Okay, fine. All right. So can you please tell me what was it? There are many people who know about sensory issues. So okay, auditory, visual, and smell overload. Okay, visual, auditory overload. Fine. More noise, lack of clarity. Okay. Okay. Lots of people movement, more actions. All right. The child at first tried to calm himself by counting, but later he had reached his threshold. Okay, over here, I would like to tell you that the child was showing. Am I audible?
Yes.
Yes.
Yes, right. Okay. Over here, the child was showing only and only visual overload. Okay. Otherwise, the child was showing lack of processing to the auditory inputs. I repeat, there was only visual overload. Few technical people may have may challenge this, but it was only visual overload. Why? Because the child did not have any coping mechanism for that. But for the auditory processing dysfunction, yes, auditory inputs also coming, all the auditory inputs were coming high. He was getting the coins were falling down, or the person is making some blowing, and then he could hear that if somebody is drinking drink, he could hear that sipping noise and all. Yes, he was taking it a higher level, but by making his own sound, like 1, 2, 3, 4, he could process it. He could reduce the intensity of all those things. Okay. Yes, it was an overload, but he had developed a kind of a coping mechanism. Okay. But when he was exposed to the visual thing, he was trying to look down, but nothing was helping him to give any kind of a soothing or any kind of a coping. And then when he was actually into the coping mechanism of auditory, and then the TV brightness he could see, and that was a very high brightness he could perceive, and then it was gone. Okay, it was gone. So it was a more of a visual overload. Okay, and then the child lost it completely. He went into the meltdown. So if I am working on this child, so I will work on his visual overload, and I will let him do self-counting. If he's doing humming, if he's doing this thing, so I will definitely work on that's a treatment part. So this is called the overload. So many people are not able to control. Many autism children are not able to did not develop any coping mechanisms for that, to how to handle that threshold. And that is called the sensory overload, which leads to meltdown because there is no coping mechanism. Okay, I did take a lecture on tantrums and meltdown, where I very nicely made you all understand about what is the difference between tantrum. Tantrum is more of a reaction. Tantrum is more of a cognition. Meltdown is where the child is completely cut off from the cognition. Yes or no? We had a discussion on the tantrums and meltdowns then. Yes. So it's more important to understand the sensory overload. So, but yes, sensory overload, everybody has a different threshold. So everybody may have a different reactions to different sensory inputs. Okay, and that's how our behaviors and our likes also develops. This is also a kind of a thing which is very important to understand over here. Let's go to the next thing. So examples of sensory overload, auditory hypersensitivity. We just saw it over here. If the child could not cope with that auditory inputs, so then I will call it the auditory sensory overload. But yes, auditory overload was there, but he had the coping. But to the visual, he did not develop any coping mechanisms. So auditory hypersensitivity, the child doesn't want to sit or doesn't want to hear the loud noises. He doesn't want to hear some cooker or high intensity sounds. The vibratory sounds the child will not be able to tolerate. The cracker sounds the child will not be able to tolerate. Okay, and the child will not be able to tolerate the shouting at him. The child will not be able to tolerate if he goes to the crowded places. He will not be able to tolerate too many sounds that are coming. See, let me tell you one thing: the sensory processing issue, okay, in which hypersensitivity and hyposensitivity comes. But sensory processing issue itself is a different thing, where the child is not able to filter out all the sensory inputs, is not able to modulate the things. But in sensory overload, there is a modulation disorder where the child is not able to control it, and it goes with a high intensity. So it's when the child starts screaming, when the child doesn't want to sit in the classroom, child doesn't want to go in the crowded places, where the coping mechanisms are not happening. For example, there are many parents comes to me and say कि garden पे वो जाता है, उसको mall में भी जाना होता है. Okay, in that social situations he is okay. लेकिन अगर शादी ब्याह में अगर हम लोग जाते हैं या अगर बर्थडे पार्टीज पे जाते हैं, तो he doesn't want to stay there. Once he has a cake, then he starts shouting, and he doesn't want to be there. And if the child doesn't want a cake, then it's gone. It's like he doesn't want to be there in that house also. So it's how the child copes it. Mall mein he goes in the mall because he likes the colors. So in colors, in looking at the colors, brain nicely focus on those colors and shops and what, maybe he's going to get a pizza over there in the food mart. So he knows that something I'm going to get. So the cognitive area may lower down the auditory hypersensitivity over there. But if the child is sent to an environment where he's not understanding anything and there is no need, there is nothing is fulfilling his need, then the child will not be able to calm that threshold, bring that threshold towards the normalcy, and then the child will show aversive reactions to that particular thing. This is a very important thing. I'm just trying to, if any parent doesn't understand कि why my child is okay, वो crowded place में यहाँ पर तो जाता है लेकिन यहाँ पर नहीं जाता है, so जहाँ पर वो नहीं जाना चाहता है, where the environment where he doesn't want to go, there is no connection with the cognition over there, there is no connection with his needs over there. That's why the child will not be able to bring his threshold down. So that's called as hypersensitivity. Tactile hypersensitivity, I explained you, few children may not like textured clothes. The child doesn't like touch. The child doesn't want somebody to touch him. Tactile hypersensitivity has two things. One is oral tactile hypersensitivity is different, and an oral body tactile hypersensitivity is different, because both the things are controlled by two different mechanisms. One is a peripheral nervous system, and second is a cranial nervous system, which is controlled by the brain. So that is a tactile hypersensitivity. A child may be aversive to the oral motor these things. He doesn't want to eat anything. He doesn't want to put any kind of a different textured food inside his mouth. But the same child may show the clinginess to others, so it may happen. That's what autism. Okay, so that's tactile hypersensitivity. Next is I'm just trying to tell you all the overload also, and I'm just trying to show you the differences of processing and this thing also. So visual hypersensitivity, we saw a very nice example. The child doesn't want to be in a bright light. Child, there was one example recently I saw that child doesn't want to look up when he goes in outside. He wants to look down only. He is not able to raise his eyes, or he doesn't want to look in the sky, but he looks down only whenever he's going in outside. So maybe the parent is attending this webinar, but this can be a reason. So I told the parent, let us see what is happening. It can be a visual ocular motor issue, but it can be more of a visual hypersensitivity also. Next is olfactory gustatory hypersensitivity. A few children doesn't want strong smells, or maybe the normal smells, but for them they are very strong. Maybe a normal food, but for the child it is very spicy. For some children, take chocolate is also spicy. They don't want the chocolate, because chocolate has it's a strong smell and strong taste. So if the child is, the threshold of the gustatory and olfactory is high, then the child may seek a lot of different texture, different tastes and smells. But if the threshold is low, then the child will not be able to tolerate the slight change in the food taste, or the slight change in the food smell also. These children may show aversive reactions to that, and the child may show vomiting, may show lack of appetite and all. This is seen, but this is very less, maybe 1% of overall autism community. Overall autism children maybe 1 to 3% बच्चे ही ये सब दिखाते हैं. But all those children who are showing aversiveness to the food products, it's the parenting which is affected over there. So olfactory gustatory hypersensitivity, and then comes the vestibular hypersensitivity. I gave a very nice example. The child doesn't want to sit in a jhula. The child doesn't want to sit on a swing or a slide, or maybe he's okay with the slide, but he doesn't want to sit on a swing. The slide has a very good control. Maybe the child is visually he's having a low threshold, so he's getting a lot of different environments. But while getting the movements, his vision is not able to get a complete information, and then the gratification the child doesn't get, and then the swing may give a high threshold, high inputs, and the child doesn't want to sit on a swing. So there are many kids who wants to sit on a slide, but they doesn't want to sit on a swing. It is not about a vestibular sensitivity or no. It's all about how the child is getting, or how the other senses are helping the vestibular sense to cope, or helping the body or helping the brain to cope that environment. So that's about vestibular hypersensitivity. There are different examples, and based on the low and high threshold, every child is different, and every child's behavior may be same. Communication dysfunction may be same. The cognitive functioning will be same. The social interaction may be same, but definitely the treatment will be different. These are the symptoms. If a child gets a sensory overload, or when the child is low threshold and he processes it at a very higher level, then what happens what behaviors we may see is I have classified based on my experiences. Let me tell you, it's not in the book and this thing, but whatever kids I have seen, I would like to present it to you all. And when I worked on them in this way, definitely I got a wonderful results in them. So sensory dysfunction, if it is a sensory dysfunction, it's an internal dysfunction. In the video, we saw the child had the internal dysfunction. Okay, so the child may show a very high or low arousal. Child may get excited, may get too much angry, or may go too low. He may go become lazy, or he may lie down, or he may not be able to show adequate alertness of the brain. Brain may develop a kind of a low arousal where he will try to sedate himself also, because that's a homeostasis mechanism. Brain will try to save itself anyhow. Okay, by doing anything. If he so the brain will go to the, how many of you, I would like to ask you, because this is something low arousal is a contradictory thing. How many of you, when you go to the more our auditory hypersensitivity doesn't want to hear too many noises, and you go to a marriage, mandatorily you have to attend that marriage. How many of you come home and sleep? Okay, you didn't attend much, maybe 1 hour you were there, you came home and you feel a lot of tired. How many of you it happens with you all? There are a lot of individual inputs are coming, but I just want to I just asked a question, can I get an answer for it? Yes. So the marriage was not a difficult thing. It was like I could see many friends, I could see many relatives and all, but still I came home and I was sleeping. And another person, after meeting many people in the marriage, okay, the person gets excited more, like I uh, the like go home, and then they after the marriage they may go to some other function also, to some other venue also. So it's very important that after hearing the loud noises, you may get excited, you may show tantrums, or you may show the meltdowns. Okay, so called tantrums and meltdowns. Let's take it in a more layman way. But after, once that thing is gone, since the brain was actually trying to work on more on a coping mechanism, the brain will go into the low arousal after the environment is removed. So the child may show both. It can show very high excitability, or it may show the low arousal. But it should be correlated with the symptoms. Next is anxiety. Child will show a lot of anxiety to get along with those environments. Or if the child, if we say let's go to the football court, child will say, no, I don't want to go, or something like that. But there's a mandatory thing, the parent has to take him, because somebody said that you have to work on a body awareness. So okay, so you have to go and play those skatings and all those things. And but the child feels that I don't want to go there because I'm getting a lot of things. Okay, children are shouting, and somebody is making the whistle and all, and the child shows the hyper sensitivity over there, or child may show the meltdowns over there. I've seen at least 3 to 4 examples like this in my career, where the child was not ready to go to the football court, but at home the child was nicely kicking the ball, the child was nicely jumping here and there, he was hyperactive. So someone told him, go take him to the football court, and then the child started showing more of a tantrums over there. Yes, so anxiety to a particular environment. Child may show vomiting may happen because of the two things. How many of you vomit when the car goes in a ghati, or when what is called when you're going in a valley? How many of you feel like vomiting and nausea? Let's see it in the chat box. How many of you feel like nausea, feel like vomiting, or how many of you do vomit in the? Yes, so that is something the brain could not receive, the turns and the things which your eyes were not getting adequate information. Have you seen any driver gets vomiting, driver more vomits in the car? Have you seen any driver is vomiting because of that thing? Very less. I mean, nothing. No, I have not seen. Driver cannot do that because his vestibular system is nicely connected with the eyes, and nicely the road is giving him the visual thing. But a person who's sitting in the back, this thing, and feeling like I'm feeling vomiting, because the vision is not helping him to understand what movement the body is going on. And that is something, the overload of the vestibular input at that moment. And that's why the body will try to create a kind of a survival reaction, that let's remove everything, I want to be fine. Let's remove everything what I have inside my stomach, because that is a fight and flight reaction of the body. I hope many of you It's a very good information from many of you. But this is vomiting. But the child may show vomiting if the child is auditorily hypersensitive. The child may show vomiting if the child is getting a lot of visual inputs and overstimulated by visual inputs. The child may show vomiting if the child is getting a tactile and gustatory inputs, which is a direct relation. Child is just vomiting, but child is vomiting, okay, but he's a very healthy child and he's vomiting. These are the behaviors. Let me tell you. Child is vomiting and he's very much starved. He's actually, you have to put the child on a glucose or put the child on supportive medications, within I mean every after these things. Then this is called as a tactile and gustatory hypersensitivity. And let me tell you, out of the 100 kids who are vomiting, only 5 to 10 children are having this kind of a hypersensitivity or overload of sensory inputs. Remaining all are behaviors because of the parents' expectations. Anyways, next is nausea. Nausea is something like giddiness and all those things comes. It is again, the child will not be able to express you, but the child will develop. We also develop the nausea. I developed nausea after seeing a very on a high building पे बहुत ज़्यादा ऊंची building पे अगर ज़्यादा वो नीचे देखता है, I definitely feel nausea. I doesn't want to. If somebody offers me a very lavish flat on a 15th floor, I will not go to stay there. So that is nausea. Aversive reaction. The child will start throwing. Child will start running here and there. Child will start showing a lot of aversions to when a particular thing is shown to him or given to him or child is taken to. Child may show the aversive reactions. Meltdowns, we just saw the meltdown over there, where the child tried to cope, right? But a time came that he could not, and his cognitive area completely cut off from the body, and he shown those particular things over there. And then quick responses. Quick responses is like the child become more alert to those overload, and then he may start hitting, or he may start showing certain low reaction time things. The child will go and just push someone or slap someone for no reason, but there can be a sensory overload in that particular environment. So this is the sensory dysfunction. Okay. Now there are environmentally provoken sensory overload criteria also is there, which I have come across in last few years. The child is able to cope with the things, but the environment doesn't want the child to cope, because the child's coping mechanism is seen as a stereotypical behavior. So environment tries to stop those coping also. He should stop flapping. Okay, he should stop flapping. He should stop saying this humming sound. The parent comes to me and says, no, he's humming a lot. So please, I don't want to stop. I just want to stop his humming. It's wrong. I said, is it affecting you? He said, no, it's not affecting me, but cosmetically is not good. But that humming is a coping mechanism for the sensory, like auditory processing dysfunction. That's why to overcome or auditory overload, the child is trying to make the humming sound, so that internal humming sound will reduce the outer environmental inputs coming to the brain. So many people, really cried in front of me when they heard that my child is humming, because they don't want to hear too many sounds coming from the environment. But in autism, the agony or the problem in the autism is people want to control the symptoms. People don't want to control the work on actual issues. They say sensory issues, but they don't say the sensory needs. There's something in the chat box. Let me see. So the child is humming, a child keeps talking again and again. That can be a part of a developmental milestone also. The child is recently started saying baba, baba, mama, mama, just like a 1-year-old child is saying. Child is saying that. It can be a kind of a verbal milestone also, but mostly it can be one of the coping mechanisms. So we have to correlate it. When the therapist is working on verbalization and the child is not able to do that, then it is more of a coping. When the therapist starts working on the verbal output, and then the child starts showing more and more improvement, then it is more of a developmental milestones with respect to verbal. It may happen in a 12-year-old child also. I have seen a 14-year-old child recently started speaking. It is because, and because his auditory overload went into a processing issue went into the coping mechanisms. We started working on the sensory issues. We asked the parent to let him keep coping, and we started giving him a lot of or we took the child into the lot of sensory motor stage of development, and the child started understanding about the environment. Automatically the threshold he could change the threshold. He started understanding the environment, and then the speech got provoked and the child started speaking few words. So it is very important that the internal dysfunctions are different, but what you see outside, they are different. So many times I've seen the symptoms, are seen as an actual problem, but they are not actual problems. So most of the time in autism, ये symptoms को control करने के लिए therapy की जाती है. Whereas a therapist should know. If I want to ask you all a question over here, because many parents say, I always pinpoint the parenting or something like that. How you come to know that you got malaria? This is very interesting. How you come to know that you got malaria? Can you please post it? How once? Okay, blood? No. Kaise? No blood test, no test at all. Okay. Fever. Any particular fever? Fever with chills. Okay. Fever with shivering. That's nice. That's great. And now you go to the doctor and you feel I'm feverish. Doctor gives you medicine only for the fever. Okay. Fever on. That's great. Everybody knows malaria. बहुत पता है सबको. Yes. So now doctor gave you medicine only for the fever. Now your fever is gone. Is malaria cured? Is malaria cured? Now the fever is gone. Is malaria cured? Exactly. Now, okay. Suppose if every day you are getting a fever, what will happen with that person? Malaria will not go. What will happen with that person? Malaria will go into the fetal stage. Yes or no? Person may die with the malaria. Yes. Why? Because the whole environment was trying to work on the symptoms. Now I'm coming to the autism. Okay, that's great. Yes, malaria का दवाई भी आ गया है यहाँ पर. Okay, in the chat box. No problem. Now, autism. Okay, the child is flapping, child is screaming, child is humming, child is putting the things in the same line. Child is showing running here and there. Child is showing some kind of a features which are come under the stereotypical behaviors. They are the symptoms. They are not the actual problems. Okay, but when the environment try to work on the symptom, so after a few days the flapping is gone. Parent is very happy. Okay, parent is very happy. The flapping has gone. And once the flapping has gone, now I want to put him into the school and he will start doing something. Okay, because the child was detected at 3.5 years because some school teacher only told him that he's flapping and he's just running here and there. The therapist and the parent nicely worked on the hyperactivity and the flapping. Okay, now the child is sitting. His flapping is not there. Do you think his autism is gone? Do you think his autism is actually gone? So now tell me if any problem. If so, the flapping was a symptom of underlying joint awareness issue where the brain was not able to register the joint, and that's why the child started showing a lot of movement to register the hand inside the brain. Now the environment has stopped that also. Okay, what the child will do? Lot of cranky behaviors, lot of meltdowns, lot of things which are unusual, hitting someone, pulling someone, distracting, destructing, and everything. And parent will say the flapping has stopped, but now he's showing one more symptom of autism, that is destructibility. He's throwing things out of the window. So this is something like environmental expectations. Like autism curing does not mean working on the symptoms. अगर मलेरिया में अगर फीवर नहीं होता तो हर 10 में से 8 लोग मर जाते. Yes or no? If in malaria, if the fever as a symptom could not be seen, then out of 10 people, 8 people will die. And that's what happened in dengue, because you get fever, but over there the things are not, your platelet count goes low. Anyways, I don't want to go into the medicine, but it's very important that symptoms are the path makers. The symptoms are path makers to work on that particular thing. So doctor should not give you or may not give you a fever on medicine on a fever, but may work on anti-malarial drugs, and then we'll keep checking whether the fever is, how the fever is arising. So it's very important. Same thing in autism also. We don't have to see the work on the symptoms. We don't have to control the symptoms, because symptoms will automatically go if you try to work on the internal mechanism, internal regulation, which is causing that symptom. These are the two different schools of thoughts in autism. And then the first thought, 99% people know, you have to keep working on a symptom. Doctor, abhi toe walking aa gaya. Now he's just looking at from one side. So I just move his head and he should look at this side also. So everybody's working on a symptom. I personally don't work on a symptom. I personally work on my observations, why the symptoms are and why we should do. Why I said this, okay, to bring you into the notice that sensory overload, okay, is mostly not affecting the child because of the sensory dysfunction. Okay, sensory overload is affecting the child because most of the symptoms are diminished. Okay, and coping mechanisms are diminished. Humming ko bhi band kar diya, so now the child is this thing, and now the environment is trying to give the lot of inputs with respect to training and treatment and n number of things, and let's say academics, and let's say the speech, and lots of trainings are happening. Because of that, the child may show the sensory overload without any acute reaction like what I saw in sensory dysfunction, like child will show sudden anxiety or sudden vomiting or sudden nausea or sudden aversive reactions. Over here, the child may show de-learning. कि कल तो उसको मैंने सिखाया था ए बोलो, A for apple, something like that, and then child को say what is this? This is aeroplane. Say aeroplane. Aeroplane. I may look funny, but exactly this happens in front of with the child who is just sitting in front of you 2 feet away. Let us say 2 feet away. Okay, just like I looked funny, the child, you are not funny for the child, but you are overstimulating to his sensory inputs, which is not necessary. And that child, okay, वो मार के नहीं, but कुछ बहुत ज़्यादा expectation because that child is connected to you emotionally. तो आपको convince करने के लिए वो शायद बोलेगा भी aeroplane. But tomorrow he will de-learn because he is not connected that aeroplane with something his learning mechanism, because at that time his learning mechanism was completely stopped. He is into the sensory overload, and now he is just repeating puppet in front of you, which the parrot may forget tomorrow. So this is de-learning. This is agony. But this is happening nowadays. Next is negative behaviors. Negative behaviors, the child may start hitting, may start these things. Last 1 month now, when I started doing some new things with him, he's just hitting. He started hitting his papa. अभी पापा घर पे आते हैं तो वो बच्चा पापा को मारता है, मम्मी को नहीं मारता है. मम्मी ने सिखाया था, लेकिन वो पापा को मारने लगा. Because father is a punching bag for him. Because father understands me, okay, or he feels a father can take my agitation. So he starts hitting the father, and father nicely take that things. But nobody understood that afternoon 12 o'clock में जो class हुआ था, okay, उसके वजह से रात को 10 बजे the father has come from the office tired, and he's getting this kind of a welcome. Okay, so are you understanding? So it's a very slow process, this thing, because there is no internal dysfunction, but a dysfunction is created from outside because of the over expectations. So this is called the environmentally provoken. How many of you have seen this? I'm not hitting the father, but how many of you have seen this kind of a behaviors? You can post it over there. This is negative behaviors, because negative behavior is not a part of autism. Let me tell you, it is a associated symptom with autism, because only in those kids where the environment did not understand the needs of the child. Next is disinterest. I think needs I've explained you in the behavior sessions also. Next is disinterest. The child actually want to play football. The child actually want to play the thing. The child has started speaking. Hi. The child started saying hi. And now the hi bola to abhi hello bhi bolna chahiye, bye bhi bolna chahiye, apple bhi bolna chahiye, balloon bhi bolna chahiye. So many things is to stop because abhi to aaya speech, you know. So this is something, and child will stop speaking hi also because उसको बोला था, उसको लगता है कि मैंने कुछ बड़ा पाप कर दिया अभी बोल के. So that's something like disinterest. Okay. Next is lack of adaptability. Child may not want to be a part of an environment. The child doesn't want to sit in the classroom. The child doesn't want to sit in the therapy room. Child doesn't want to sit in the speech room. Child doesn't want to be with a particular parent. Child will show adaptability. Child will not be able to create a connection with that particular environment. That is a lack of adaptability in a particular environment. Irritable behaviors and slow developmental changes. The child's development will definitely become slow in this kind of in this kind of environmentally provoked sensory overload, I can say. How many of you are understanding this? Let me understand what my audience is thinking about this. Is it relevant, parents? Is it relevant? Are you feeling this is relevant to you all? You can post it in the chat box, because let me tell you, the sensory dysfunction where the child is actually showing meltdowns and all, very simple for a therapist, and for a therapist like me and every therapist. They are very simple to work on it because there is no contamination of the behaviors, you know. But if there is a contaminated environment, you know, because of expectations, because of wrong we can say wrong understandings, you know, then it is, ये हिंदी में बहुत अच्छा शब्द है घातक, you know, it is more destructing to the child's development. So these are two types of sensory overloads. One is sensory dysfunction and second is environmentally provoked. Sensory dysfunction based sensory overloads feels severe dysfunction. Okay, वो बहुत ज़्यादा dysfunction, वो severely दिखने को आता है, but they are very easily understood and very easily can be handled. But environmentally provoked, they are difficult to understand because child is hitting the father, but actually sensory overloader is mama. Okay, they are the child is hitting other kids. Okay, or child is hitting other kids because sensory overload can be the parents are sitting on a bench and go and play, जाओ भागो. The child doesn't understand किसको सुनूं, बच्चे को सुनूं या मम्मी पापा को सुनूं पीछे. So the child, and to rectify it, we may have to see the environment back home, because nowadays we are understanding, because of the online sessions, we are understanding exactly what parent is with the child at home in a natural way, or at his own habitat. We are able to see. So we could we have a clinical discussions among the therapists, and then we could come to the conclusion that there's no much problem with the sensory issues in the child, but the problem is more on the environment, how the environment is helping the child to understand, or how the environment is provoking the child to develop those behaviors. You know, so these are the symptoms of the sensory overload. And once it's not about once we treat, we cannot treat it. Once we are able to make a parent understand about it, and once the parent understands it, then it can be covered. Otherwise, it cannot be covered. A therapist cannot work on it. This thing, unless and until the parent is not ready for it. It's the sensory overload due to environment. What are the different overloads can happen in the environment? I have seen in the therapy sessions also that it happens. It happened in my early stages also. I used to give. I am not very much prone to pediatric field. I was in my early stages of profession. I was doing very good in adults, but because accidentally I came into this field 15 years back. Okay, that story I will tell you some other time. But you know, so I was knowing very less about pediatric field. Maybe because of that, I have reached so far in this field I could see. I'm very lucky to see so many kids, because many parents kept a faith on us. But I've seen in my early stages that I used to give a jumping, okay, because he's hyperactive. So there was a protocol, okay. If the child is hyperactive, giving calming things. If he's hyperactive, giving jumping. So what I did, I gave a jumping to the hyperactive child. I just wanted to see what happens. One child became more hyperactive, another child became very much hyperactive. So I used to write down my things. So maybe more than 2,000 pages I have written on my own observations for first 1,000 kids. But it was mostly understood that what it was more that time. It was more I wanted to provoke my protocol on the child. Over there, I was not very much trying to understand what child wants, because maybe it's a very early days. I came to know that later on. Development is more important than the protocol. So I used to provoke the child, and then the child used to cry, and the parent used to tell me, last 2 days he's crying a lot. Okay, fine. Okay, I understood that after giving him a lot of ball bouncing, he's crying. Then I came to know the child is gravitationally insecure. Okay, and I should not give him a vestibular input. Rather than that, I should give him a kind of a thing which will cover the vestibular dysfunction as a subconscious process. So I asked the father to take him like a kanda butter and run like that. Now the child was more connected emotionally to the father, and child started, the father started running here and mommy ko pakdo, something like that, and the child subconsciously got a vestibular input, and there the child, shown much better result than what I was expecting from the ball bouncing. And later on, when I asked when I called the child on the ball, and then I could produce the speech development also later on, because the child's vestibular input was not very much ready to accept anything. So we wanted a kind of a mediator, so that the child's brain will start taking those vestibular input. And once we got the mediator, and then we started giving the child more of using it more technically, we started getting wonders. So it's more important. Sometimes training approaches, where the child's active participation is lacking, but still in next 45 minutes, I have to follow this protocol. Okay, come on, do this. हाथ पर चलना है. Okay, कितना 15 मिनट हाथ पे चलना है. This is something. Now I laugh on myself, but yes, first 6 months to 8 months was like that. But later I understanding what I'm doing. I mean, I was not enjoying that. I was not enjoying the what outputs I was getting. I gave you one of the story also last time about the emotional support. But yes, there were a lot of failures also from my side. But I was trying to understand what I'm giving, and there I came to know that there has to be, the child should be involved in that. You have to match with the child's temperament. You have to match with the child's abilities. You have to match with the child's current level of functioning. Unless and until whatever you give is going to be a sensory overload. Thanks God that it came. God gave me a very early insight about the child's inner drive is more important, But yes, there are many people, many parents doesn't understand that. They feel, okay, they have read, okay, this child is flapping, so he must be walking on a hand. But because of the hand walking, what is happening with the visual development? They don't want to understand. They just want to understand walking on a hand will reduce the flapping. Okay, so that's called the training approaches while child is active participation is lacking. It's very, very important to understand, all of you. Maybe if the therapists are attending this, there are many therapists who are also attending nowadays my lectures, but this is very important. Next is sensitizing without inner drive. It's exactly same thing I said. Child doesn't want to do it. Child's basic. There's someone who is unmuted. Can you please mute yourself? The basic occupation of a child is play. Always is going to be a play only. You cannot replace play with any other thing. Okay, child should get that much adequately. And the children who played well in their early stages of life, they are the successful people. Be it autistic, be it normal, be it anything. Those who played, those who got adequate inputs in the environment, from the environment, and from their inner drive, they are the very, very, very good and nicely doing in the society. Let me tell you, I'm one of them. So sensitizing without inner drive of the child. Okay, next is voice modulation not used appropriately. Okay, voice modulation. What is this? This is watch. Say watch. I mean, I may be exaggerating, uh, but this happens. Okay, so voice modulation does not mean screaming at the child. Voice modulation does not mean shouting at the child. Voice modulation does not mean raising your voice so that it will pierce the ears from all the side and will go to the brain and my child will start speaking. This is a myth. Okay, voice modulation can be, what is this? Oh my God, this is star. This is complete voice modulation. So there are many people who are half knowledge. Again, maybe a therapist, maybe some experienced parents may give this kind of ideas and then keep shouting at the child, but they don't understand that they are actually too much loud. I mean, if they do it in some other child in front of a neurotypical child, the child may slap them. Sorry to say this, but this is a fact. But unfortunately our child has no other way, because neither the environment is understanding them, neither the home environment, but somewhere I'm getting the food, and somewhere I'm getting the shelter, somewhere चलो 50% नहीं तो 50% कुछ तो मिल रहा है. So and lot of emotional bonding, lot of emotional support is the parent is actually giving. So child somehow tolerates that. But let me tell you, it is not going to lead to a development, and that I would like to put it into the sensory overload only. Next is too many commands in a short time. चलो खाओ जल्दी 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 खाओ, अरे अरे इतना ही चपाती छोड़ा, अरे जल्दी, अरे देखो देखो इधर देख रहा है, अरे उधर मत देखो उधर मत देखो, अरे अरे इधर ये करो, चलो अरे चपाती खाओ. अरे वो खा रहा है ना यार, खा रहा है ना, अभी चपाती खाने के लिए 36 बार चबाना पड़ता है, आपने ही सुना था, लेकिन वो यहाँ वहां देख रहा है, वो क्या कर रहा है. तो that is a sensory overload. Yes or no? Please post it in the chat box, because everybody is doing it every day at least 3 times: breakfast, lunch, and then dinner. Let me see the chat box. This is funny. This is funny, but this is the agony in autism. That's why they say autism is not curable. Okay, so child is supposed to eat. आधा घंटा है, उसको भूख लगी है, तो वो जितना खाएगा उतना उसके लिए अमृत है. You know, I don't know what is called what English word is for अमृत. You know, लेकिन अगर उसको ठोस दिया बाहर से, ओके, कम टाइम में, या उसको भूख ही नहीं है लेकिन टाइम के हिसाब से दिया, and that child doesn't want to eat and you are pushing him to do, मोबाइल दिखा के, स्क्रीन दिखा के, भीम दिखा के, कैप्टन अमेरिका दिखा के वो खा रहा है, and that is, you are actually trying to take the child away from his own physiology, and that is the problem seen in autism. Because neurotypical child वो खाना फेंक देगा, मुझे बोला नहीं चाहिए, बोला ना मैंने नहीं चाहिए. But autism child will not be able to say this at the age of 4 years also and at the age of 14 years also. And that's the problem, that where the parents are indirectly losing the bond with the parent, the only connection which a therapist, you know, a very ethical therapist is going to use it more efficiently to develop your own child. That's why a few minutes back I said कि environmentally provoken things cannot be done directly by the therapist unless and until the parent understands his own, he is the own part of, okay, that overstimulation. So that is something like too many commands in a short time. लिखो लिखो जल्दी जल्दी लिखो, अरे उधर देख रहा है, इधर देख रहा है. अरे the child at least gets some kind of a coping mechanism. Child is looking here and there. मैं भी करता हूँ. If I'm not able to get into the topic, I look here and I look there. You know, that means it's a kind of a coping mechanism for me. Everybody has. But no, you should be attention has to be there more than army. Okay, वो आर्मी का चेहरा यहाँ वहाँ हिलेगा लेकिन अपने बच्चे का नहीं हिलना चाहिए. Anyways, that's I'm just trying to take it funnily, because life is funny. I always take it as a funny way. So too many commands in a short time is a sensory overload to the child, A good therapist only will be able to tell you ki how fast I'm supposed to talk with my child and what should be the interval of when I talk to my child. This happens with the Down syndrome. There is one lecture I already on a radio I had taken, and I got a lots of phone calls from the and messages from the Down syndrome parents that there is a called as a window period. How many of you know Down syndrome? Maybe your friends and families who are coming for the therapies, maybe you become a friend. A Down syndrome child is a very particular child. Okay, they are either your friends or they are your enemies. They become your friend if they feel your inputs coming from them coming if they understand the inputs coming to them more better, then they are your friends. But if the person is a bit impulsive and trying to push the child, the Down syndrome is a very, very difficult child to handle in the therapy sessions. 10 years back, 10 or 12 years back, I used to keep a Down syndrome to my new trainee therapists. तो उनको मैं वो बच्चा दे देता था, and then I used to understand कि whether this therapist has equal adequate patience, adequate understanding or no. Later on, those therapists laugh at me as sir, आपने हमें बहुत जबरदस्त फंसाया था. But the child was my pet. He was amazing. He used to lock my door when I used to close the shutter. He used to sit with me for 2 hours. But that child never wanted to sit with certain people. It is because the people were too much informative to the child. Those people who was too much informative, he never used to take them. The people used to understand his way of information taking. He used to be very, very, very nice. So this is something very, very important. But in autism, the Down syndrome, they are reactive. Their responses are very appropriate to your reaction, to your inputs. But in autism, unfortunately, their affect is not developed. Their expressions are not developed. That's why they are not able to express the kind of a thing that they are not able to put your mouth shut, or they are not able to stop you by showing an adequate and appropriate responses. And parent doesn't understand, or therapist sometimes doesn't understand that that I'm giving too much things to the child. So this is something. Next is parent using excessive verbal communication, where the child is actually operating from the non-verbal communication. Just a moment. Today I am sitting in my Nagpur branch, and it is functional since last few days, but unfortunately there is no network over here. Yes. Am I audible?
Yes.
Great.
Yes.
Next is parent using excessive verbal communication when the child is unable to understand. Child's operating system is non-verbal. Okay. चाइल्ड का ऑपरेटिंग सिस्टम आईफोन का है और उसमें अगर एंड्रॉइड का डेटा डालेंगे तो क्या होगा, मोस्ट ऑफ द डेटा will be said data not identified. Okay, or let's say, I mean, I'm just not very much good in software and all, but अगर ऑपरेटिंग सिस्टम में अलग है और उसका जो डेटा अलग है तो वो रन नहीं होता है उस ऑपरेटिंग सिस्टम में. So there are certain pictures I downloaded from the Google, but those pictures are not seen in the PPT. So I have to discard those pictures. So it's very much understandable in terms of software, but it's not understandable in terms of child's development. The child is not speaking, that means he should speak. That's my expectation. But he's not speaking, his operating system is non-verbal. He's understanding your expressions more better than your words. But unfortunately, we want him to speak, so we will give him a lot of verbal data. And in that phase, the child will lose out connection also with the parent, because the parent, when the child doesn't speak, parent become more provoking, therapist become more provoking, and then the poor child is doesn't understand. I mean, if you send a data which I understand, I will at least go ahead. But if you're trying to send a data with what you understand, what you want to provoke, I probably last 6 years you're trying, but I will not be able to speak. This has happened in many kids I have seen, many kids, So it's very important to understand what is the operating system of the child. Child is jumping here and there, that's his operating system. You should not stop that jumping. You should use it into the normal functions. Child is non-verbal, you should use that non-verbal to develop n number of expressions. A person can live in this world with appropriate expressions, but person cannot live in this world words without expressions. I repeat, a person can go to China, can go to any world, any country in any part of the world, and non-verbally, if his expressions are matching with his needs, that person can survive. So person can live in this world without speech, but person cannot live in this world without communication. And communication is something like sending the intention, beliefs, ideas, and thoughts from one person to another person with the interface, either a mouth, either the verbal way or expressions way. But in autism, expressions are there in the beginning. The child, autism definition should be changed. They are very good in understanding the expression. They know that person is angry, the person is happy, the person is loving, the person is jealous, the person is this thing. They understand it, only they are not able to respond to that. What I have seen, but we don't want to understand their software. We try to put our codes into that software. So that's something is a problem in autism development. And that I call it as one of more reason behind the sensory overload. Then parent and therapist coping mechanisms of the child. As I'm actually stressing it a lot today, the child is showing those coping mechanisms, those stereotypical behaviors. Let us say aligning the cars or aligning the objects is a kind of visual development, let me tell you that. But it is a kind of a thing where the child tries to come out of the visual development and tries to transit from one level of visual development to the next level visual development. But unfortunately, the visual development ko dekha nahi jata hai. And ye dekha jata hai that he's just aligning the things, and then what sometimes therapists say, remove all those things, keep it into the shelf, and he should not see that again. Give him the puzzle or give him something that you want him to give. This is where the autism is not treatable. The child was actually developing a kind of a visual development. Visual localization was getting converted into the visual tracking, but unfortunately that was stopped, and child stopped that stage of development, and now the child is only looking at it, only giving visual localization. Anyways, if the therapist is there, he will understand. At least he will try to work more on it. Next is sensory stimulus is given without understanding its application, its intensity, and its frequency. One child is hyperactive, I may say that, okay, give him a trampoline jumping for 15 minutes. The another child is hyperactive, I will say no trampoline, remove the trampoline, you make him sit on the ball, remove the air, and give him that jumping on the ball with that we can say very, very lousy therapy ball. Two different inputs, and definitely based on my assessment, both the children will definitely develop much better. But over here, there is a lot of things are given under Google. Google gives you activities. So there everybody in the different groups is asking activities. Can you please give me the activities of how to stop the hyperactivity? So 10 activities are given. I will use all the 10. तो यहाँ पर अगर मुझे बुखार है तो मैं पैरासिटामोल भी लेता हूँ और मैं ठंडा पानी भी पीता हूँ. What will happen? It will nullify, and that's how if you don't understand exactly, and for that you should assess the child, which is more important. I'm not saying I'm going to assess your child and you come to me. I have enough load back home. But it's very important. There are so many people who are unethically, without understanding the child's condition, without assessing that child, is giving the suggestions openly, because there is nothing to lose for them. कि अपना बच्चा क्या कर रहा है वो लोग नहीं बोलते हैं, लेकिन दूसरे बच्चे को कैसे ठीक करना ये उनको सब कुछ पता होता है. But they don't know how to take care of their own child. I mean, I'm sorry to say that because of this, actually autism is becoming more difficult in next 5 years. Next 5 years is going to be a very difficult time for all those people who are generalizing so many things in their child. This is the agony. our work will increase. That's a different thing. But you know, that's the agony. Without understanding the child, you are suggesting you should go to the school or you should not go to the school. The parent is suggesting okay, he's not eating, then start doing this. Okay, he's not fine, he's not able to identify the colors, so you start doing this. This is somewhere is a problem is getting created because of the digital social media. Okay, so it's something like sensory stimulus is given without understanding its application, its intensity, and its frequency. Today morning, I took a review, and over there I asked the parent, next few days you are going to give all the social interaction and give the child, and after that you're going to become a cold parent. You know, become a cold parent, because we cannot expect the child is always getting the kind of inputs and then the child is playing with it. You know, child ke andar agar social interaction develop hua hai, then he should change his place and he should come and interact with the parent. And that's what I want to see. And that's why I asked the parent to become cold now. Cold parenting is an issue. Few sessions back I said, but over here the parent is supposed to be cold, because now how child leaves his place and comes to the parent and connects with the parent is more important for me, because I want to move ahead with respect to autonomous social interaction. You know, every time all the environment is not going to help the child to interact with the same way what parent is doing in a playful manner. Somewhere the child has to be autonomous on his own. So I asked the parent, stop giving all the stimulus after 1 week, and my therapist is going to observe that. So same way, every child is different. Every child's developmental stages are different. Every child's developmental stages based cognitive ability is different, and every child's developmental stage based cognitive abilities based environment is different. So you need to be very specific in deriving the protocol, and before saying any protocol, you know, assess the child. It's very, very important. You know, same parent may say you do this, do that. After that, that parent will not ask also what happened to your child. You know, because you don't have time to with your child, because he wants to guide 100 more other parents with the half knowledge. This is very important. So autism is curable if you do the assessment and the treatment together. It has to be a 90% observation and 10% you should be provoking that protocol. You know, it's very important that after some kind of inputs, the child is asked to live in his own world. Let him do the stereotypical behavior, because that is his own cooling down period. Okay, so 10 minutes you are doing a good job. After that 1 hour, let him do that. I have said this to one parent. After that 10 minutes again you are going to do. Okay, kitne jan ko borewell pata hai, kitne jan ko sorry, I'm just going out of this context. How many of you know the borewells? I mean, I came to know few. I mean, 2 years, since last 2 years, I'm more associated with the borewells because I have a farm. So, okay, how many of you borewells? So certain borewells has a lot of water reservoirs, so they can work on and on and on and on, and your pipe, your motor can be on for 12 hours, okay, or 24 hours. But certain borewells has a very limited water reservoirs. Okay, are you understanding? Please put it yes. Limited reservoir. So अगर 15 minutes में वो borewell चलती है, 15 minutes the motor is working on the borewell. After that the water gets over, and you have to put that motor off. If you don't put that motor off, that motor worth rupees 35,000 will get burnt because there is no water to pull up. Yes or no? How many of you know this mechanism? So the farmer has to put that off and let the water settle coming from the earth. Let the water settle in that reservoir. So after 1 hour, the farmer again starts the borewell for 15 minutes, and this is how he can nicely take care of his farm. But there are some farmers I know. Okay, there are some farmers who wants the borewell keep going and on and on and on and on, doesn't, by not understanding what is the capacity of the reservoir. So बच्चा 10 मिनट वहां पर अटेंशन दे सकता है, ओके, तो उसकी कैपेसिटी 10 मिनट है. वो 10 मिनट में अगर वो ग्रेटिफिकेशन भी लेता है, उसको मजा भी आता है, और इक्वली वो लर्निंग भी करता है, बिकॉज दैट्स व्हाट द सेंसरी मैकेनिज्म इज. Sensory mechanism gives you gratification and then learning. But the environmental need is 30 minutes. Okay, so you should sit for 30 minutes. How I'm going to increase that 10 minutes to that? I'm recently taken that lecture on SNCC, that how to improve your child's sitting tolerance, and where the conclusion was, let him do whatever he wants to do. You utilize his available tolerance rather than increasing the sitting tolerance. And that was more important. So it's something like sensory stimulus is given without understanding its application, intensity, and frequency. This is more important. Okay. Otherwise, the same sensory input which was supposed to be the sanjeevani for the child becomes the overload, and then the child starts showing the aversive reaction to the same medicine called sensory stimulus. There's a lot of prachalit word called sensory activities. This sensory activities is a hazardous word for the autism community world. Let me tell you that. There is no term called sensory activity. The brain is always getting the sensory inputs. In the next picture, I'm going to show that you will understand exactly how the brain should work and how the therapist should work in that mechanism. So sensory stimulus, and next point is sensory stimulus is given, the environment is not matching with the child's abilities and development. The environment is not matching with the child's abilities and development. Child is able to solve all the worksheets with respect to the junior KGs autonomously. He knows how to write A, he knows how to write B, he's able to draw some pictures also, and he's doing it very nicely. उसको बोलना नहीं, उसके साथ बैठना नहीं चाहता, उसके साथ बैठने की कोई जरूरत नहीं होती. There is no need of any teacher or person or parent sitting with him. But the same child is, because of his age, is supposed to sit in the first standard, but he's not able to understand what they are teaching. So their so-called farmer will try to put one more motor in that borewell so that it will work as a supporting machine, and will try to teach the child, something like that. So it's hazardous. It's overstimulation, because the child is not understanding that environment, and somewhere he is not understanding. He's not cognitively. He's not a part of that environment. And there we give a kind of a support and kind of assistance, and keep increasing the child's performance on paper. But nobody looks at the paper. Nobody asks me what is your degree is. Nobody asks me today what you have learned. People ask me the knowledge. People get connected to me because of my communication. Maybe get connected because of the problem solving and decision making. Yes, it's very important to develop the child in the personality, not on the paper. To develop the child for his own happiness, not for your own happiness, for your own satisfaction that my child is going to give 10th exam, or he's past 10th. But actually, what is the child's actual functionality in the environment? That's not be seen. Today morning, one of the review I took, and then the parent asked me, Dr. Sumit, where you want to see my child after let us say, what is the future of my child? Where you want to see my child? And I said, after 5 years, I want to see your child going to the neighbor and then telling that mummy ne ye diya hai. Not telling, but he should be able to convey that. He will be able to cross the road properly, and he will be able to go to the shop and buy the things as per the list given by you, and he will be able to autonomously cook his food, and he nicely should be enjoying his life. Koi hai ya koi nahi hai for that. And the parent was, I don't know whether the parent was satisfied or not satisfied. I didn't ask, because that's a very subjective thing. It's very important. The child's environment should be matching with his cognitive ability. अगर वही बच्चा जो फर्स्ट स्टैंड में बैठा है, अगर जूनियर केजी में बिठाया जाता है और वहां से अगर उसकी डेवलपमेंट की जाती है, तो दैट चाइल्ड विल फर्स्ट ऑफ ऑल will never show the negative behaviors, and he will never need any support, and his brain will learn autonomously. And that autonomy is everybody searching, but nobody knows exactly what they want. Everybody wants autonomy. My child should survive on his own. So if I want my child to survive on his own at the age of 15 years, then while developing the coding, जब सॉफ्टवेयर बना जाता है तो उसमें कोड्स डालने जाते हैं, तो वो कोड्स के वक्त अगर आपने असिस्टिव कोडिंग डालेंगे, तो 15 years में you cannot expect the child is autonomously living in this world. So I am a bit against of this shadow teacher. We were running a shadow teacher training course, and then When I asked myself, my team said we are doing very good, we should take more and more together. But I asked myself, am I helping this community? Then I came to know that I'm helping few people to get job, but I'm actually ruining the autism child because it is creating a wrong hope in the society. And then I stopped that courses abruptly. We were getting a wonderful admissions, but somewhere it is not ethical. Anyways, I hope you understood it. Everything comes into the sensory overload. Every child has ability to learn, every child has ability to live these things, but only we have to, the parent is supposed to be understanding the environment, what is more suitable to my child. In that environment, how I can be how I can make him more efficient. Okay. I have a wonderful example. This is not related to sensory overload, but definitely in the relation with this context, what I just raised now. The child was in senior KG, completing the senior KG, and parent was sitting in the review, and I said, "Ki, this is the time that I want to stop his therapies, okay, and I want your child to be developing as a normal kid in the society." Okay, in next 2 to 3 months I will stop my things. He may go to the higher function level, but you have to put him into the senior KG. The child was nicely reading the words, child could draw, child could do everything. He was absolutely fine with respect to senior KG level, but he was not able to communicate because his social age was something backward. Okay, so the parent was having a debating with me, if he's doing so good in the academics, why should not he be sitting in the first standard? I said first standard can happen at any age, but right now he's about to come out of autism. This is the thing which will happen now. सूरज चांद और धरती हर वक्त एक लाइन में नहीं आते, और हर वक्त तारे सब तारे एक लाइन में नहीं आते. Okay, there is some time comes where you can leave, where you can shoot that rocket, where you shoot that satellite, and that is going to go on Mars and the moon. So over there, that was the time where the child could nicely very easily could do the studies over there, could get a lot of appreciation from the teacher, and then he could have become famous in the children's community over there. And then the limited communication he had, limited social interaction he had, could get a nice support because of his own abilities. That's what the criteria. But somehow the parent did not listen. He said, no, I don't mind to continue the therapist for next 2 years, but I let him go to the first standard. After first standard, June, July, August, September, and the child started getting lots of complaints that he's not sitting at one place, he's roaming here and there, he started hitting other kids, and he was starting. The child did not show any such behaviors in the previous development. Why it happened? Because child had, and I still feel bad about that child. This thing happened 6 years back, 5 years back, in 2015, but I still feel bad about the child, because later on the child never came out of it, because that was the time he could come out of autism and he could relate himself with the outer world, and this thing. But unfortunately, parent decided to go with his trained abilities rather than acquired abilities what he was supposed to get during in that play based, senior KG based. The younger children were supposed to come, and he could have gelled very well over there. It's very unfortunate. This is why maybe in certain lectures I speak a lot, because there are certain cases actually gives a lot of pain to me as a professional. Management by the parents, if it is environmental, how the sensory overload should be managed by the parenting. Help the child to avoid triggering situations. If you think the child is de-learning, if you think that child is showing negative things, if you think that something has started and child is not very much comfortable with you, if you think that child is not connected with me, if you think that child is not giving decreased his social smile with me, if you think that child is actually going away from those apparatus, then understand and avoid those triggering situations. Things will come again. Okay, you will get a time, you will get a chance again, but this is the situation where you have to work on the actual developmental stage rather than the cognitive stage of the child. Next is give the child words to explain what is happening and how it feels. Okay, if it is a sensory dysfunction, then the child is feeling that this thing. So to ask the parent to move his hand on on your hand, ask the child, and the parent, move his hand with the same intensity on the child's hand. Then ask the child that child will move his hand on the parent's hand, and the same intensity child will move his hand on his hand. This is how the exchange of information can happen in a playway manner, where the child will be able to understand the response of the parent and response his own, and there he can develop that insight that I have to develop this kind of affect what the parent is giving, and then the parent can move into the desensitization technique told by the therapist especially. uh, then give the child words. Oh, it is no, this is one more thing that if a child is a dog comes to the child, and child is very this thing very much difficult for the child to understand. Parents should take it, and my, oh, we're so cute, oh my, his tongue is like something like that. The parent will give all the sensory information to the child and make the child comfortable in that. Maybe the child is sitting for 1 month, and the whole month the parent is only playing with the dog, parent is only playing with the kids, and then making the child understand about the actual responses which are required. Then it can happen that child will start showing a more better adaptability in that particular environment, along with definitely some sensory processing techniques and sensory desensitization techniques. Validate the child's feelings and experiences. Yes, I understand that this is painful. Somebody please shut that TV sound. Please shut that. I am angry. I don't like it. If the mother says, and if the child, then the child will understand, okay, somebody is there to understand my feelings. This is more important. Okay. Somebody's understand who's exactly what I'm not able to express. Somebody is able to express it. This is very important, that when the parent matches his affect with the child's affect, then only the autism treatment can happen wonderfully. But when the parent sees as a this thing, oh, he's screaming, let me write down in ABA model. Okay, child is screaming after watching TV. But the parent is very rational over there. But over there, the rationality is not required. There is a lot of nurturing is required, where the parent is feeling there is a term called catharsis in the psychology, where the person has to feel the pain of the another person who's sitting in front of. Then only this person will be understand what he's going through, he or she is going through. So over here, the parent has to show that catharsis is more important. I don't know the word catharsis or something, but it's more similar to this. Yes, next is taking regular breaks and getting enough rest and sleep. If you give a kind of a sensory input, the child enjoyed it. Now don't go far. The child should stop. You should stop when the child is enjoying the most, and then stop that particular thing, and then give some time for the child to leave on his own, where the brain has to masticate the information. With whom happens the mastication happens with the cows and buffaloes, right? They eat a lot, and later on they bring it out, and then they keep chewing it, keep chewing that chara and all those things. The same thing happens with the autism child. The autism child can masticate the information for days and days, or for hours and hours. That's why something happened 2 days back, the child is speaking now. So we need to understand that pattern, and then regular breaks are required over there. So there are certain kids, there are certain parents, अभी 12 बजे therapy, 1:30 बजे खाना, उसके बाद उसको वो क्लास के लिए जाना है, then he's supposed to go to the tuition, then he's supposed to go for that particular class, then he's supposed to go to that Sangeet ka class, then music, then guitar, and then this. And I'm going to make my child a more very celebrity kind of a thing. The child will not become celebrity, let me tell you. The child will become celebrity only when it is coming from his inner drive, and he is ready to do that. Otherwise, don't do that. I have seen those children were given enough time in their first seven years. No activities were given, nothing was given. That's why the international protocol is also coming. No writing and no reading should be given before the age 7. Those kids actually are they are the scientists at NASA and maybe at Microsoft and maybe at Google, because they did nothing in their early stages. They only did as per their abilities and then the environment they got. But those people who got a lot of information, probably they are nothing in the nothing in the environment right now. So let's understand this pattern of the brain's learning. So next is taking so that's why taking regular breaks, getting enough rest and sleep is important for the child. Drinking lots of water and eating a balanced diet. Let's remove the eating balanced diet, because there are many people will ask me, what is a balanced diet? I don't know that. Whatever your child loves, give him diet. उसको अगर chocolate खाना पसंद है तो give chocolate with the chapati, no problem. Chocolate chapati के साथ भी अच्छा लगता है, bread के साथ भी अच्छा लगता है. ओके उसको अगर चाय पसंद है, उसको अगर इडली पसंद है, तो चाय में इडली डुबो के उसको खाने दो, कोई प्रॉब्लम नहीं है. If he is enjoying his food, he will develop better. But there are many people who wants to negotiate with the child's habit of eating, child's healthy diet, and there they are missing the very important bond of parent-child bonding. And if he is not following you for the eating, no, then that child will never follow you for any learning, let me tell you, because the physiological needs are the primary most needs of the brain. If there you are not connected, you cannot connect with anyone. No, physiological needs, there are many people, the bond of friendship, anyways, the bond of friendship is more better when they drinks together. That friendship is this thing, because they are connected with the physiological needs. But the bonds of friendship just on very good these things and all, they may become a competitor to each other. This is something apart from the jokes, this is very important, that those people understand each other physiology. If you understand your child's physiology, if you understand your child's likes, he doesn't want to eat fruits. What a big deal. There are so many people who never had any fruit in their life. It's okay. Or my child will, once in this particular developmental stage will get over, in the next developmental stage, he may start having these things. I never ate any kind of a green leafy vegetables when I was young. I used to feel like that methi and all those palak used to stick in my mouth, and I used to feel yucks. But now I love methi, I love palak. It's something like you change as a personality once you move from one developmental stage to another developmental stage. But there are some people who don't want to accept that developmental stage, and they want to, the child should eat everything in that particular stage. That never happens, and that should not happen. Next is inform teachers and possibilities of the sensory overload and ask them for the support. Yes, if the child is supposed to go to the school, if he's a part of a school, tell the teacher, yes, he's a bit these things. So you don't have to make him sit in front of you. He's a bit auditory hypersensitive. Let him sit back of the these things. 2-4 बेंच पीछे छोड़ के बैठेगा तो वो तो उसका पहला नंबर दूसरे नंबर पे नहीं जाएगा. Child will feel better, because this is the actual example was happening. The child didn't want to sit in the classroom, in a particular teacher's classroom. So me and my team at that time, the schools, we used to visit the school and see the child. My team sees the child. Is a particular team for school observation. So the team goes, sit in the classroom and observe the child, observe the teacher, observe the other kids, observe the child's interaction with the surrounding, and we make a report and we tell the school. It's amazing process happens in my, because we are a big team. So over there, the child was not sitting for one particular teacher's classroom, but otherwise he was okay with that. And then we came to know the teacher was amazing, but she was a bit loud. And she was loud and she was saying, A for apple. And every child was enjoying that, but this child was keeping his hand on his ears, and then he used to get irritated. So we said, Madam, you are amazing. In your class, make him sit behind, and then the child reduced, and slowly those behaviors were reduced. So this is something very important, that seek help from the teacher, make them understand exactly what he loves, what he doesn't like, and this thing. One more nice example. I have given this in my previous lectures, that there was a child who didn't develop the potty training, or he used to do potty in other things. Like in उनके घर पे जाके वो पैंट में potty करता था, या he used to sit outside only. He didn't want to go. He was not going in the toilet, and this was happening for a year, and maybe probably the longest child whom I was working as a potty training. So, but in my center, he was doing it. He was coming. He was telling him, but at his home he was not doing it all. So parents were about to change the house also. What happened at that time is like the parent called me for Ganesh Darshan. So I generally I don't go, but I thought of going for the child, to see the child, and then I went for the Ganesh. Then I thought, okay, there was a natural way. I mean, it's a very coincidence. I failed of using the toilet, And in that toilet, what happened? When I flushed, the flush sound was something like dush, dush, or something like some squawky noise was coming. And I said, this is unusual. This is something different. And I asked the parents कि ये flush का sound ऐसे ही आता है क्या? तो they said हाँ वो थोड़ा सा वो pipeline कुछ तो वो plumber ने ऐसा ही किया है कि वो बहुत जोर से पानी फेंकता है or something like that. So I said okay fine. Okay, I asked someone to go to the toilet and then ask the door to open and do the flush again after 5 minutes. And then I just looked at the child and I saw the child was doing this. So I thought ki this is a auditory hypersensitivity which was actually affecting the child's adaptability at his own toilet. And since last 1 year, he was doing the potty in his pants, okay, at home. This is an amazing thing, is an amazing example of this thing I said. Don't change the house, don't change the therapist, change your flush room and ask the plumber to use a more silent flush. It was a matter of few days, and then child started going to the potty. You know, this is the fun of sensory overload. You don't know, you cannot figure out most of the time what exactly is. And if you are happy, if you are lucky, or maybe if the child is happy-go-lucky with the environment, then the child himself starts showing those difficulties. But if there are acquired difficulties by the environment, then we see the child is showing the aversive reactions to every other sensory input, and then it is difficult for the therapist to understand whether he is a sensory dysfunction or whether he is environmentally broken, because every environment the child is showing dysfunction. But if the child is given adequate opportunities to understand the environment as per his abilities, as per his cognitive functioning, then it is more easier to understand the patches of the aversive reaction and patches of the good behaviors. The ABA will work more better. I mean, I'm not promoting ABA. ABA is something different, but ABA का ABC model, antecedent behavior and consequences model, will understandable over there, and then we can identify the antecedent and we can work on a sensory processing over there. So this is about the management by the parents. And next is the types of therapeutic management which are supposed to be in the sensory overload. Is something सबसे पहले is very important. I didn't write is right assessment and enough time given to assess the child. There are many people. The therapist is seeing the child since last 6 months, okay, and therapist knows all the reactions on it. Then the parent goes to some other professional. I'm not against of it. Definitely, you should go for your child. Other professional. That professional within the one sitting, something he says ki, this is wrong, this is right. Without having adequate observations, without talking to the previous therapist, when this happens, then this is something, unless and until that professional is very much experienced, and he's able to figure it out more confidently, or then it is fine. But he says something, and then the parent starts doing something, and then the therapist who was actually working very appropriately on the child, the parent may come and just says, Farana said asked me to do this, and you change your protocol. And therapist doesn't understand what to do now because he feels that he's doing appropriate. So there has to be a kind of a communication in the assessments of the people. But I give a slam if some parent has said to do that. I don't agree to that. Anyways. Types of therapeutic management, occupational therapy management. Occupational therapy is a field of neurosciences where the occupation of a person is understood. A person has different occupations at a different given times. For a child's occupation is a play and developing the gratification and definitely learning and academics also. The adult he was a carpenter and he was not able to understand, or the carpenter, but he was unable to do his certain functions, or maybe a person who's sitting in front of a audience and is not able to express his thoughts and express his knowledge properly, then there is some problem in the occupation. Or maybe kind of a disability, maybe kind of an accidental disability, the person loses his function. There the occupational therapy comes and try to understand, assess, evaluate the functions, what is the strength in that function and what is we can say the weakness in that function. And then the occupational therapy creates a protocol and tries to work on it by the different ways, developing the adaptive, restoring the functions or some activities, you know. But unfortunately in the community it is spread like OT activities. तो मुझे ऐसे लगता है कि OT activities means अगर मैं चौथी में भी अगर फेल भी होता तो भी मैं activities तो बहुत ही कर लेता हूँ. So why did I learn that 4.5 years? Why did I spend over there? And why I'm learning, and I'm learning every kid today also. Why I'm reading so much to become an occupational therapist, professional. So occupational therapy management is something not giving activities to child. This is a very wrong term called OT activities. Okay, OT activities. Okay, there is a swing, there is a this. ये मैंने घर पे ला गया, मैंने सब कुछ करना शुरू कर दिया. That's not right, and that's absolutely you're only putting yourself into the trouble. You know, आपको हथियार लेकर आए लेकिन उसका यूज कैसे करना पता नहीं है. That हथियार can become a leader to you also. Next is sensory integration therapy. It's a part of occupational therapy approach, okay, where by the understanding the dysfunctions and the functions of the sensory inputs, the occupational therapy will try to work on the child's learning abilities. Okay. Next is the cognitive behavior therapy. Is if the child is having enough insight, if the person is having enough insights about his own difficulties. Dr. Sumit, I cannot go for the movie with my husband, you know, and that really annoys me. I try to tell him, but I don't want to go, but he loves going to movie, and then we have a lot of quarrels that he wants to go with me for a theater and he's not. So something, there is a lot of differences between those parents, and there I had to guide her with respect to my psychologist was supposed to guide her with respect to cognitive behavioral therapy to overcome her auditory hypersensitivity, because in theater there is a Dolby digital sound and there was dang something like that. She used to get irritated with that because of that. So if the person is cognitive enough, he is able to think, he is able to solve problems, he is able to understand, take the decisions, then the CBT works on the sensory overload more efficiently. Next is sensory desensitization techniques. The child is a bit tactile hypersensitive, auditory hypersensitive. There are desensitization techniques like giving a certain sounds. We can there is a term called AIT also, but it is not just the desensitization technique, but with the desensitization, you should be working on the cognitive understanding of the receptive communication. But in that, the music therapy or AIT doesn't work on the cognitive functioning of the thing that I have observed in my previous experiences. So over there, I thought, why not to integrate, or why not to indulge those things into those particular things into the those approaches into the cognitive element or the developmental element. And then we got a wonderful results over there with respect to auditory hypersensitivity per se. So sensory desensitization techniques, where the child is given a particular input, subconsciously and consciously the child is asked to give attention to the thing which is more appropriate for the child. Next is medications in a severe condition. If the child is hitting self, if the child is actually running here and there is vomiting, is actually difficult, very difficult condition for the child to control himself or to parent for the control of the child. Then the medications are given to calm down, to sedate the overall brain. Over here, the brain will get sedated overall. तो यहाँ पर सिर्फ विजुअल हाइपर सेंसिटिविटी को सेडेट करके वो नॉर्मल पे ला रहा है, लेकिन बाकी के थ्रेशोल्ड उससे भी कम जा रहे हैं. So over here, it may happen that prolonged medications to work on a sensory oversensitive or like oversensitive kids or hypersensitive kids may affect their long run cognitive abilities, because in that the child will not be able to get the information and process the information with this optimum level of threshold, because the child is sedated in that period. So it should be used only when the child is actually very much difficult for him to for himself to handle, and is difficult for himself or difficult for the society. So these are the types of this thing. And now this is something like management of sensory integration therapy. What you will see over here is 5 horses. I'm not a very spiritual person, but I understand spirituality. So over here I thought this is the best picture to give you a better understanding. Now let us assume that these 5 horses are 5 sensory systems you have, and the Lord Krishna over there is the brain, okay, and what Arjuna over there is the what I want to do something. I want to go out. I want to go out and play with the kids, or I want to go and I want to get something from the shop. Over there, this five, can you see this picture? Everybody can see this picture? Let me see. Everybody can see this picture. Let's, तो ये पिक्चर को मैं ट्राई करता हूँ. Let me see if I can do something with this. Okay. So can you see this? Can you see this in the paint, Sushant?
Yes.
Good. Okay. I don't want to do this. हनुमान जी को ऊपर भेज देते हैं. Okay. So यहाँ पर, if you see these five horses are the sensory systems, and every horse has its own lagam over there. Every horse has its own lagam. Okay. Or every sensory system has its own threshold. Okay. And it is there in the hand of the brain. Okay. The brain is supposed to control that, but brain is controlling it with those lagams. Can you see that? Can you please put it in the chat box? Yes, right. Now let us assume that this is the visual sense. Let us assume that this is the visual sense. This is the auditory sense. Okay. Or let us say this is olfactory sense. This is a touch, and this is a taste. Okay. And we can say, well, we can add one more horse over there, and we can call it as a vestibular sense. Okay. So all those things has to create, should be like, for example, if I am playing football. So what the brain should do? The football के लिए क्या जरूरी है? Visual sense, the vestibular sense is more important, and the auditory sense is more important. Yes or no? Right? So for that, ये तीनों को लगाम छोड़ देगा. Okay? तुम भागो. तुम्हें भागना है. You have to run. Okay? Visual sense, look everywhere. Okay? Auditory sense, listen to the sounds. कहाँ पर ball pass करना है? Children, these things. You have to be more of these things. At the same time, the vestibular sense, you have to run here and there, understand your body. So all three things are helping each other to locate the ball, to understand the people, to understand the environment. But at that moment, the touch sense, the brain, what it will do? The touch sense will be pulled back. Stop. You should not be moving ahead. You should not give adequate information to the brain, or you should not take too much of information. Yes, stop that. Stop that. Okay, the brain, what it will do? It will stop the touch sense. Suppose over here, if the touch sense is also lived by the brain, what will happen? Please put it in your chat box. Please put in your chat box. If the touch sense is also given enough shoot or enough freedom over there, what the behavior will happen? Please tell me. Tell me. What happens if the touch sense is given enough freedom over there? What will happen? The child will start noticing about his sweaty shirt, and he will start getting sweating. Okay, or he will start understanding his sweating. They will start understanding more about the things. Exactly, he will get distracted, and he will start exploring the sand, and the child will sit there and will start playing with the sand. While watching the kids playing, while listening to the things, but he wants to explore the sand also because the touch was supposed to be stopped over there. Yes or no? That is appropriate adaptive functioning of the brain, which is supposed to happen in sensory integration therapy. Okay, now I'm sitting for the studies. Okay, what should happen? The brain will give enough truth to visual sense, enough truth to auditory sense. Okay, but it will stop the vestibular sense and will ask the vestibular sense, be where you are. Now you're sitting, now you should not be moving. Whatever the body awareness you have registered in your mind, now you have to continue that for next few more minutes and all. So be ready with, be happy what you have right now. And these two things will be given, okay? That also visually, the child is supposed to be using more of a localization than the tracking here and there. Okay, so there also the neck movement should be stopped because the vestibular is stopped. That's why the neck will become more steady, and then the child will start reading the minute word on the paper. So that may happen, these things. Okay. Now child is doing masti with the child is playing with the other kids like tug of war. Over there, the tactile sense and all those things, the tactile sense is more important, the vestibular sense is more important, but over auditory and visual will not be this thing. So this is everything, every senses in every activity should be pulled by those lagam. This lagam is very important. And this lagam is a particular sense called proprioception. Okay, you're sitting in a giant wheel, but in that giant wheel, you feel weightlessness. What you do? You hold it tightly and you feel better. That's the proprioception. Is helping you to reduce the intensity of the vestibular sense. And maybe the child is, you are hearing a big loud cracker sound. Okay, Diwali cracker sound, its sound is very high, but you make your body a bit tight and then you hear or you modulate that sound as per its requirement, and then the child, then you enjoy that cracker. But maybe someone is passing by them, he could not modulate it, he didn't get enough time, and that person gets shattered. He says, in our society, no firecrackers will happen. But you are enjoying and he will not, he could not enjoy because he didn't get enough time to modulate it. And that happens with our kids. They are not able to modulate the senses because of the lack of lagams over here. So kya hoga? These lagams are having no things. I mean, let us say size is big and then the lagams are not there. Sorry, something happened, and the horses are running like that. I'll just go back. Okay. Horses are running as per their speed. What will happen? If the horses are running as per their speed without integrating with each other, without coordinating with each other, what will happen to the body? Please tell me. If the horses are running with respect to without having enough lagam, what will happen to the body? It will run very fast. It will get excited, but in that excitation, it will get derailed and it will not be able to reach to its own destination. So it's very important. That's how exactly it's collapsed, and that's what happens in autism. So I think this was the best way I could explain you what sensory integration is. Agony. There are many people sensory activities. I mean, please come to me and explain me what sensory activities are. So I'm just stopping the share. Let me see what I'm doing. Stopping the share. This is gone. Don't save. Sorry, Lord Krishna and Arjuna. But it was the best way I could explain the community this thing. So where is my PowerPoint is gone? Okay, now. So this is called as a sensory integration therapy. A good sensory integration therapist will understand, what is the child's behavior, what is the body behavior, what is the child's development, where you want to take the child, where you want to take the body, where you want the cognition to go, so that it will start creating a lagam for all those sensory systems, or it will give a chute to those sensory systems in an appropriate way, and then the child will develop adequate adaptability in the environment. Okay, it's very, very important. And that's why sensory activities, so-called sensory activities, which are generalized word nowadays, is going to be, people are going to cry next after 5 years that this autism thing is going to increase and increase because the treatments are generalized. There is no specific treatment is happening. People say there was a lack of there's an increasing awareness, but let me tell you, in 1995 or let us say 2005 and all, the autism ratio was different, and now the autism ratio is different. You know, because uh, we are creating the false cases, or the cases could have been continued into the society very efficiently. They're still following they have to follow the treatment, they have to follow the regulations, because there was a lot of contaminations in the treatment. Thanks a lot for this. And so the takeaways from today's lectures are uh, sensory overload is a condition that may lead to aversive behaviors in autism children. It is a brain's inability to process the information from the environment and body. It is completely treatable with proper management. There are some silent sensory overloads that do not show acute symptoms, but definitely affects a long run developmental issues, behavior issues, and learning issues because of the unfortunate and unnecessary expectations from the environment. They mainly arise from the expectations and half knowledge. Next is, we need to give more stakes to homeostasis mechanism. What is homeostasis? Our body can heal ourselves properly, but and as a therapist, I should give a I should create a way where the brain will develop adequate coping mechanisms to overcome his own sensory dysfunctions. But unfortunately, this coping mechanisms is only uh, documented as a problem of autism, and that's the problem of autism communities happening, that those symptoms, everybody's running behind to stop the symptom. So if you that's why that's why the malaria is curable because of the symptom. Unfortunately, cancer gives the symptoms at the end, and that's why the doctor says you have gone to the third stage, because something was happening in my stomach I could not understand, because the soft tissues does not give us enough pain sensation, and that's why the stomach cancer goes very high, and then at the end you come to know, oh my god, I have only 6 months to stay. This is something like, if the disorder without a symptom is the most dangerous disorder on this earth. That's why no one try to work on the symptoms. Sensory overload is absolutely manageable, but you know, the autism child who's just sitting in the chair and is not showing anything is more severe autism than the autism child who's running here and there and trying to explore here and there and just doing some behaviors. This child will be more easy to develop. So it's more important to don't work on symptoms. Okay. We need to give more stakes to homeostasis mechanism. That's a homeostasis where the brain will definitely overcome its own issues, but we have to just make it more happy. Let it work more happy. Let's not create more and more difficulties in its own processing. अगर वो एक जगह पर नहीं बैठ रहा है, अगर वो ऑडिटरी हाइपर सेंसिटिव है, तो उसको खाने के वक्त तो उसको ज्यादा डिफिकल्टीज मत दो. अगर वो शायद कम्युनिकेट नहीं कर रहा है, स्पीच नहीं कर रहा है, तो उसको एटलीस्ट वो फुटबॉल के मैच में तो मत लेके जाओ. Focus on speech and give adequate rest periods. You will definitely overcome your child's autism. Definitely, you know. So it's more important that these takeaways, if you understand, so you can help your child not just work on his sensory overloads, but to overcome his own autism conditions also. Thanks a lot, people, for listening to me on this sneak webinars. There was a parent, Harshali, Shiruguppe madam, she approached me 2 years back, and that's how we started this wonderful Nagpur center. And because of some certain parents, like the many parents who are behind me to come to the Nagpur and start with this center, and we are helping many kids over here. Over there, during the discussions, I came to know that there is no proper guidances people are getting and this thing. And I was getting a regular notifications from the parents that you should do something. And then that's why I started with the groups of autism parenting. In that autism parenting, what happened that everybody was suggesting their own child's problems. And when I started working on the problem, that every other parent started, imitating those things, and then I started feeling this is not ethical. So thought of giving you all this knowledge, whichever I have experienced in my career, I thought of giving this so that tomorrow any person has some issues, they can refer to this and definitely they can work on it. So ultimately we come in the world just to create experiences and just give those experiences to the society so that you can live in this world forever. Okay, so this is what I feel that that everybody should understand. Last thing but not least, if we say 2% autism, let's do some mathematics. I made an article, but I don't think so article will go that far. If we see there is a 1.5% autism rating is there, like in 100 kids there are 1.5, like 60 में अगर एक होता है बच्चा तो 100 में दो होंगे, this thing 100 में 1.5% है, तो 135 crore people. How many autism people will be there in this India? Please tell me. How many autism children are there or autism people are there in our country? Please put the number. As per the 1.5, at least it should be like 2 crore people will be suffering from autism. Yes or no? Please give me the validity. If 1 in 60 is suffering with autism, right? Yes. So 2 crore people are suffering with autism. Okay. Do you see 2 crore people are there? Approximately 2 crore people. So 2 crore means every here and there you should be able to see. Yes or no? Okay, let's say 3 crore. I am taking only 2 crore. But do you see 2 crore? No, we don't have 2 crore. Maybe hardly few lakhs. Yes or no? Maybe 10 or 15 lakhs. Max to max 10 or 15 lakhs. Maybe I'll tell 10 lakhs people are operating from autism. That means remaining 1 crore 85 lakh children with autism did come out of autism, and they are living a very normal life in the society, which is not seen otherwise. I mean, they are autism. Yes or no? Please give me a validity, parents. Only 15 lakh people may be suffering from autism, and that too I'm giving a big number. Yes, but because of this social media, there are some people who are actually, and why those children are coming out? Why those children 1 crore 85 lakhs are coming out? It is because of good parenting. Appropriate parenting, maybe right treatment, maybe undisturbed treatment. But in this scenario, I'm seeing this since last 3 or 5 years. There's a lot of social media based exchange of knowledge is happening, and this exchange of knowledge is actually creating a lot of contamination in the treatment process of those kids. And because of this, we are seeing the autism incidences are happening more and more. Actually, they are not more. They were the same, but they were supposed to get into the homeostasis mechanism, and they were supposed to heal their own, or maybe some kind of a treatment. But nowadays, this community, so-called parenting or sharing the parent to parent, is increasing. And believe me, अगर ये 15 लाख में से अगर 30 लाख हो जाते हैं, अगर ये आंकड़ा शायद हो सकता है कि अगले कुछ 4-5 साल में ये आंकड़ा जो 15 लाख हमें रोड पर दिखते हैं, 15 लाख हमें घर पे दिखते हैं, तो ये आंकड़ा शायद 30 या 50 लाख तक अगर जाएगा, then maximum part of the families are going to get suffer in this thing. And without understanding that where they went wrong, that's very important. And that's, I feel ki with my mind, body, soul and heart, that this should not happen. This should not happen. There is already there is a less support system is there, but don't try to create a false system. Don't try to create a false things. And definitely therapists come from the treatment, but sometimes the parental expectations also make them go into the wrong strategies. There are a lot of business happening still. Yes, everybody is here to earn money, but earn money with ethics. We have to understand the ethical way of practicing. Be it a therapist, be it an educator, or be it a teacher, or be it any professional, be it a doctor. They should understand From what I am earning this money? Am I earning by fooling by someone's emotions? Am I earning money by making some business proposals to each other and making some kind of a thing? That should not happen. And that's why, after a few years, this will happen, that there's an increased number of autism people incidences, unresolved autism, and because of this false remedies and false people, few people will be searching in the Antarctica for the polar bear's milk, which some article will say the polar bear milks improve the autism, and some people will be searching for that also. Yes, that should not happen. Autism is a very simple disorder. Autism is just lack of communication, lack of interaction, and presence of some stereotypical behavior which are showing the symptoms of autism. But it is not hyperactivity, it is not academic dysfunction, it is not a cognitive dysfunction, it is just lack of social communication dysfunction. So if you work on it and you give more stakes to work on it, and later on you can definitely, once the child starts coming out of it, once you give a kind of education or the skills and these things, and by understanding this sensory overload, if you understood it, then definitely you can help your child to come out of it early as possible or with the maximum functional outcome. Thanks a lot, Sneak, for helping me introduce these topics. Thanks a lot, parents, for bearing me for so long. Thank you. We are not taking the question answers because I have to take a session in next few seconds. So I'm just logging off now. I think I have given enough today. Thank you, Arshali madam.
Thank you, sir.
I've given the number. You can pose the questions to this. Thank you.
Thank you so much, sir. And I'm sir stated that in Nagpur center, actually it was a great help for us. I know it's very difficult to run a center from Mumbai to Nagpur, but that was the great and the biggest help that we Nagpur parents got. I mean, thank you so much for that. And thank you so much for today's session. If any questions, we have put phone numbers. Autism helpline, you can contact there. Yeah.
Thank you.
So, thank you so much, everyone.
Thank you.
That's great.
Sweet.
Thank you, sir.
Thank you.